Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to our series on concussions in children and adolescents. And joining me to continue this discussion is Dr. Sally Fryer-Dietz. In episode 1, Sally walked us through dispelling myths and understanding what is a concussion and how they occur. In this episode, we're going to continue discussing the assessing, the interventions, and the evaluations for someone who has a concussion. Sally, I am so glad you could join us for episode 2.
Thanks, Candace.
All right, so I really want to get this started with, you see a child that is in sports, maybe a football player. That seems to be kind of a pretty popular place, and you see someone go down on the sideline. What really happens once we go out there to start looking at whether or not they have a concussion?
Well, first of all, it should actually start before you even start the season. And the first thing to start with is a good baseline test. That is a test that looks at what your cognitive abilities are at that moment in time. And if there is a concussion, we can refer back to that and see if there's a change from that initial testing. The other thing that should occur before somebody's, you're playing a game is that there is somebody who is designated on the field to be watching for concussion. And, different schools, private schools are different from public schools in what their requirements are and what their protocols are. But many schools have an athletic trainer, if they're lucky, on site who can be there to diagnose. Some, not diagnose, I'm sorry, only a doctor can diagnose, but an athletic trainer can assess the risk of a concussion and refer to either the physician or an emergency room. Some teams, some high school, competitive teams might have a physician on the sidelines that's keeping an eye on things. It could be a coach. It could be, parents who are trained in concussion signs and symptoms. There's lots of different sideline tools that people can have on their phones, lots of different apps for, how to do a screening to see if there's a risk of a concussion.
Do you have an example of like a tool that they could use on the sideline?
On the sideline, well, it's more of a training than a tool. There are a variety of apps. I could look on my phone, but you could just Google, baseline apps. There's an impact app. There's a, just all different kinds of things that can take you through different kind of series of tracking. But what's really most important is somebody who is trained specifically in looking at vestibular function, which is your balance and postural reactions. Somebody who's trained and understands functional vision, which is looking at the smooth pursuits and the saccades and the VOR, or how your head is able to turn and fixate on an object. You want somebody who's trained in doing a quick assessment of cognitive function, like the Maddox questions, questions that, ask about, where you are, what inning is it, or did you play sports yesterday? What school do you go to?
Who scored last?
Backwards? That's right. Who scored last? I have actually a personal story. This is, it was 20 or 15 years ago. My son played rugby, and I've been a physical therapist, doctor of physical therapy. I've over 40 years, but we didn't have all the concussion science or knowledge that we actually do have today. And I watched him get knocked down, and he was a little goofy afterwards, but then he went on to score 2 more scores in the game. And after the game, he said to us, "I think I got a concussion." It was high school, but he was acting kind of fine. He didn't look particularly out of it or anything. And so really, and his dad was a physician, we weren't that concerned about it. The next day he went to school and he watched the video, and he had no recollection that he scored 2 more, tries after that particular hit. And so
Oh, wow.
at that point, we kind of got more conservative, but even then nobody, really knew
Right.
what was going on. So,
Treatment has definitely changed over time, and one of those additions is the concussion specialist. How does that play
right.
a role? How do you get training for that?
So, a concussion specialist is really a term for somebody who has advanced training in concussion management. In my case, I'm a physical therapist. I'm part of a concussion team. All by myself. I'm not the whole picture. That's just my profession, and I have training in vestibular rehab, functional vision, balance coordination, how the body works, all those kinds of things. An athletic trainer who is trained in concussion management. And they're a little bit better about in their education, at least today, having, you know, concussion management as part of their training protocol. Just like in every profession, though, not everybody's created equal. Your background and experience is all different. Um, Occupational therapists can be a valuable member of a concussion management team. Same thing, a lot of them specialize in functional vision and in cognition. So, really looking at those kinds of things. Speech therapy could be part of a concussion management team because, the speech, the fuzzy thinking, cognitive processing, all those kinds of things may play into it. Um, you may have manual therapy, physical therapist who specializes in whiplash injuries and problems with the neck, but they have additional training specific to the body and impacts. Um, Same thing goes for physicians. Just because you're a pediatrician or an orthopedic doctor does not mean that you're 100% a concussion specialist. You really, that needs to be your focus of practice, and that you have a deep understanding of what the current literature is, what we need to be looking at, how to assess a concussion and accurately diagnose it.
Absolutely. Yes, it's kind of like a one of those niche areas, but we're really seeing
Right,
the importance of it. As it's been highlighted, especially with NFL players who
right,
retired and who are saying, "Hey, I have long-term effects from this that we didn't realize this is where it came from." So
right. And
it's
what's
very
really more,
important.
right, what's more important than just any one specialty or individual, it is the team approach, because every single injury, whether it's a concussion or actually just about anything else, they're all individual. We're all different, and we all have a different history, and we have a different impact, and we have a different trajectory for how we recover. So, you could have somebody who has more vision impairment, or you could have somebody who has more vestibular or whatever, and maybe that specialist, um, after you have the initial assessment, the specialist who looks at you should be able to refer you, if it's not in their wheelhouse, to the appropriate person to help with those things.
And speaking of differences in how we all learn, grow, male versus female, do you see a difference? And I know probably more football with males, but what do you see with
Mhm.
females?
Well, statistically, the number of injuries are greater in girls than they are in boys.
Oh.
Uh, I think a lot of the reason may be just because of skull density, body mass,
Mhm.
just the neck muscles, how what the sport. The highest rate of concussions happens to be with girls soccer,
Oh, I have a
more so
soccer
even,
player.
yeah,
Oh
even more
no.
so than the football in many cases. But football and soccer are the two highest for that, although more girls get reported with injuries than boys. Some of that as well may be who's doing the reporting. Girls tend to report things a little bit better than boys
Mhm.
do. Boys have a lot of a lot of times peer pressure to stay in the game and to keep working and to mask what those symptoms are. Whereas girls, if they don't feel good, they usually will let somebody know. Not
Right.
always, depends on how competitive they are.
Well,
But
and I wonder if it has to do with the culture around those sports of.
absolutely, I think so. Yep.
Mhm. So, what makes children and adolescents different as far as assessing them and why they, have the concussion? Some plasticity in their brains.
Well, you have to look at sort of the bigger picture, where an adolescent is developmentally. And it's not just physical or emotional, but you have a lot of social peer pressures and just like you just mentioned, the culture around the game. Younger children are developing very rapidly on a different, in a different way, more physical and that kind of thing. So you have to kind of understand the age group that you're working with and be able to do an assessment that's appropriate, uh, you know, for that age group. You're still going to do the same sorts of things. You're still going to look at vestibular function and balance, but in a 7-year-old, you might have them um, trying to kick a ball or stand on one foot or whatever. Whereas an adolescent, we might use a biodex machine to really measure their balance or do some more active uh, VRR and visual tracking of vestibular kinds of tools that are a little bit more sensitive.
So, it's really understanding and knowing those developmental stages when they come in and you start doing those assessments on them to see where they are.
Right. And also knowing the history of that child. That's why it's so important for parents to be really kind of forthright in their entire child's history. Does their third grader have trouble with reading and writing? It could be an early sign of a learning disability, whether it's diagnosed or not yet. Um, by high school, you may have a diagnosis of ADHD or depression. Those are not uncommon diagnoses. And both of those things for those different age groups can set you up for a longer recovery.
And it's so interesting to hear that they could have those prior to a concussion, but they could have those develop because of a concussion. And
Correct.
and if that research, is that research out there that really shows the percentage of people that end up with this diagnosis after a concussion? It would be so interesting to test for. I don't even know how you would
Right.
test for that, but
I know they don't have it yet, but you have a lot of clinical observations. We see a lot of patterns whenever you're looking at overall development. You really have to look at the patterns, no matter what it is having to do with development. It's not just about could you do this or not do that, but what's the trajectory of how things happened. It's not uncommon. I've seen kids who were, A students, just like top of their class, have a bad, concussive injury, and they have a really hard time getting back into school and focusing and thinking and processing information. And that that could go on, in some cases it could go on for months. And if it's not, this is where that rehab is so important and that guidance is so important, because if it doesn't get addressed and a child tries to muscle through that, whether they're masking symptoms or not, but they're going to school and they're coming home with terrible headaches. They can't do their homework. They can't sleep well that night. They go back to school. They do it again. The sounds are driving them crazy. They start getting depressed. They don't, they can't play their sport because maybe they just don't feel like it if they put them in there, or they're just not ready because they're still symptomatic. And it can cascade into a long-term problem. Whereas if you have somebody who's guiding you through it, you get your initial rest the first 24 to 48 hours, and then we see what your symptoms are. You go to school, how do you feel at the end of the day or a half day? Did you have a headache? Were you tired? Can you think? Whatever. If there's no symptoms, that's great. Let's go to school again, have a longer day. No symptoms, a little bit more. We start adding some exercise, and we've already looked at the other things. So you can, really stage that developmental progress so that they can recover quickly and effectively and to a full recovery before, again, you muscle through it, your reaction time's off, and you run into a locker and hit your head again, and now you've got that second
Square
injury.
one. Yeah.
Yep. And you're
Right.
square one plus, squared.
Yeah. You got extra.
Yeah.
So what does that, so you have someone who has a concussion, they start concussion therapy. What does that look like?
So what we do in our clinic, we have a whole variety of tools, just like all the different specialists. We have PTOT speech that we all work together, and athletic specialist, manual therapist. And we have a therapy called craniosacral therapy, which is a soft tissue manual therapy. It's extremely effective for reducing symptoms. We see, all of our patients for it, whether they're a professional athlete or a child. It helps to calm the nervous system. It helps to release tension patterns in the body that can help to promote the healing. We use that after we do an initial assessment. First thing we'll do is the initial assessment, looking at the vestibular function, functional vision, cognitive, range of motion, all the regular things. But those things tend to exacerbate symptoms because we're challenging the body, when it's just at the beginning of that healing process. But you have to kind of know where to start. We're still, if they have terrible symptoms when you're doing it, you're going to have to back off and not complete that test. But we'll do that, and then we follow it with the craniosacral therapy. And I will tell you, probably 95, maybe 97, 98% leave with a smile on their face after that cranial work because it is so effective. That's your first step. From there, we prescribe a kind of the beginning of a rehab program, depending on the kind of symptoms that were elicited in that initial eval. So if they're extremely symptomatic, you're going to start, with very, very low intensity. Maybe it's just, walking around the house, or it could be walking around the block, whatever seems to be, the appropriate level of activity for them. And you measure what are the symptoms afterwards. If the symptoms are a lot worse, it's they did too much. If they have no symptoms, then you can add on the next day. So you're constantly, it's that just right challenge of giving the nervous system input, but not stressing it out, not doing too much. But if we don't do anything at all, we find that that's more associated, especially in adolescents, with more depression and anxiety because they're away from their friends and they want to get back to doing stuff.
Well, on average, how long does that initial therapy last?
There's no average. It depends on the person and on the injury. Um, what the the next step with all of those, say they do fine with their walking, they're able to get back to school, we move into what we call a return to learn protocol. And that is, are there different cognitive tasks that are more challenging or less? Do we need accommodations in school to be successful? Same thing, just right challenge until they are asymptomatic with learning. Then you can talk about return to play. Um, you can start that return to play with, some just general conditioning, the walking and everything that kind of is, where you start at the beginning. But as far as getting back into your sports, whether you're thinking and using your head on a computer or in school, or you're playing the game, your brain doesn't know the difference. It's input. The brain is having to work hard with both of those things. So if you're symptomatic with learning, you are not ready to play.
That's so hard for a child or an adolescent.
Right. Especially if
Uh-huh.
they were a really good athlete, beforehand. But it gets back to why education is so important, and, really having those discussions about even though, adolescents, they're their own little, they live in their own world to a certain extent, but it's a very short period of time in your life. You know, we're really looking at the big picture. Um, you know, Parents can be interesting sometimes because a lot of times parents are really wrapped up in their what they perceive as their child's success in wanting to, maybe they were going for that college scholarship or something, and they want them back in the game.
And they can become a barrier to their healing, to the healing process. Yeah.
Yeah. But I would say most parents, if really got down to it, would say the most important thing that they want for their child is for them to be happy and healthy. And
Right.
so if that's our goal as a parent, to set our kids up for success, then we want to do all the best things in their best interest down the road.
Hmm. Do you find that the schools are accommodating to these recommendations, especially as you're getting them ready to return to learning?
Not always. A lot of teachers, I like to say it's getting
Coaches?
better. A
Uh-huh.
lot of coaches. Um, it just gets down to, as we all know, everybody is different. You have some who are really on it, and you have others who live in their own world in the way they see things. And um, but it falls back on why it's so important to have a good um, kind of medical team behind you. Having a physical therapist or an occupational therapist who's really, or an athletic trainer who is guiding your rehab, who can be your advocate in setting up, if there needs to be accommodations in school, or setting up if there needs to be, some kind of a modified school or work schedule. Um, it's it's harder for a teacher to argue with a medical professional as compared to a parent or the child. The child is almost like, you know uh, helpless in the whole
It's
system because they
they're
don't
kind of
know,
torn between,
yeah,
this is
how to
what I need to
advocate for
do.
themselves.
Yes,
Right,
and even without a concussion, I know that sometimes children and parents and the medical team have trouble with those 504 plans actually being followed.
right,
So you go through all that paperwork to
right,
then have to fight it in the classroom.
right. And those things take a while to get in place, even. So
Yeah,
you really
absolutely.
can't rely on your school or the educational system to um, necessarily be on top of it the way they should be, in my
Absolutely.
experience.
Yeah, here too. So, research I know is showing that nutrition really plays a factor in the healing from concussions. Can you kind of walk us through what that looks like?
So it takes a lot of calories for your brain to heal, or even, any kind of injury, surgery, whatever. You need calories to heal those tissues. So it only makes sense that you should have good nutrition to feed those cells so they can recover and be healthy. The things you do not want to do are, you do not want to drink alcohol. You do not want to take aspirin. You do not want to drink sugary drinks or sports drinks. A lot of those electrolytes have a lot of salt in them. Those are all like the worst things you can do, especially initially. Um, think about how somebody's on the field, they get hit with a concussion, and they bring them a Gatorade.
Yes,
It's
they do. Yeah.
not a good idea, okay? Because you're now flooding the central nervous system with sodium, and your brain is trying to balance itself out, and it just exacerbates all the stuff going in. Um, Protein, you want good healthy proteins, ideally grass-fed beef and chicken, um, you know healthy things that have good healthy fats with them. You can have, dairy, that can be a good healthy protein. Omega-3s are really good for you. Um, Lots of water. The first thing you should be drinking is the water. Water, just kind of helps to our body is primarily made up of water, and it helps to naturally chelate out some of those, that imbalance that goes on. So those are your big ones.
So I know you talked about the sugar, or not the sugar, the salt.
Well,
But
sugar too is a big no-no.
right, that's what I
Sorry,
was going to
I
ask
didn't
you.
mention
So
that. Yeah.
what is
So
it with the sugar? Because Coca-Cola, they are, there's soda drinks that they love.
yeah, any kind of sugar drinks, Cokes, ice cream, even candy, stuff like that. It's not a healthy. It's not healthy for your body anyway. We want to avoid the sugar part. Sugar and
No.
salt are the kind of big no-nos.
So I know with sugar that can cause a lot of inflammation in the
Right.
body. And
Yeah.
so if you're already struggling with a concussion, it just seems like that would be inflammation in the brain per se.
Right.
So that
Right.
sugar would then make it worse.
Right. Yeah. And that's another reason that actually, it kind of brings up medicines. You really, shouldn't be taking, definitely not aspirin. Um, you know, Before you take anything, you really need to go through your physician. Um, in some cases, you can take some not Advil, Tylenol if you're really, um, sore or have some other issues. But I would not automatically give a child Tylenol or Advil, or definitely not aspirin, because of the bleeding um, risk without going through your physician initially.
So in those first few moments, you see a player down on the field, waiting to get them evaluated by a first responder, someone to decide if they're going to take them to the hospital. Don't bring them a sugary drink.
Right? Don't do that.
Bring them some water.
Don't pull them up until you make sure that they don't have any kind of a neck injury. Assess their, consciousness on the ground. See if do they have any pain? Can they move their feet? Can they move their hands? All the kind of initial screens that you would do from a first aid perspective. If all that checks out, they can sit up and you can do a visual scan. You can do it very quickly, moving your finger very slowly across. Can they track your finger doing those smooth pursuits, or is there a jump? With the eyes in any one direction. Same thing, up and down. Is there a jump that goes on? Are their pupils equal? And then convergence is another really good quick screen where you might have your finger or something out in front of them and ask them to keep their eyes on your finger and watch for when their eyes cross. And you should be able to get pretty close before you start seeing your eyes cross about 6 centimeters or millimeters or whatever, just about right here. And be able to tell. But if they have a really hard time and they can't, do it, then that's a big sign that there's something off with their vision.
And now, one of the other things that I saw was eating small meals frequently during recovery.
Yeah, and that just kind of, again, it actually kind of maximizes the calories that are going in if you eat smaller meals more frequently. Again, of the higher, protein, so that you're not just overloading your body with food and input.
So really, we're looking at avoid overeating, no fried foods. What about
Fried foods aren't really that healthy for you. They're not the right kind of fats. You're better off having, an avocado shake or some healthy nuts, or, some eggs, or, something that is just a cleaner kind of food.
So you want some clean proteins, and we know in healthcare that protein is really that very important nutrient that we need when we are healing, regardless of what kind of wound it's healing. And so really that's also beneficial for the brain too.
Right. And you think about, if you've ever had a comparison between eating a really crummy diet, like you've, had to do a bunch of night shifts for a month and you were eating, McDonald's every night and a Happy Meal in the morning, or you're just like eating awful
Yes.
stuff.
You feel terrible.
You don't feel very good. And as compared to you go on the Whole30 diet or something, and all of a sudden you're like, wow, I've got good energy. You feel better. You can take on the world. So, diet plays a big part.
Absolutely. I've actually just finished the Whole30, so very familiar
so you know
with
what I'm talking about.
That anti-inflammatory diet. But you really do. Once you get off the initial sugar, salt kick, you really do start to feel better. So I understand that. And you also, because you have inflammation that you're now trying to get down in the brain, it does make sense for an anti-inflammatory type diet.
You'll see a decrease in headaches and the fuzzy thinking, and a lot of other things.
Yeah. Well, we are coming to the end of episode 2. Is there anything that we haven't covered, or maybe you want to cover a little bit more in depth before we end?
I think the big thing is just be as well educated as you can. Don't just think it's not a big deal. When in doubt, sit them out. There's that whole thing.
That's a good saying.
Yeah, just like with kids, we just we're their protectors, and it's really up to us as health professionals and parents and teachers and coaches to do what is right for the highest good of that child. And I don't know that anybody would say that the highest good is getting them back out there to play because they're your star player. It's just, let's look at the big picture on why we're doing all these things in the first place, so that kids can play sports safely, and we can do the right thing for them if they are injured, and we know the right steps and the right advice to give parents. And so much of it comes from just misinformation and just not knowing, just kind of out of ignorance that things happen. So you have more information now, and you can use that to your advantage, and really, do what we need to do for these kids, and refer them to the right kind of, a concussion clinic, a specialty clinic, a specialist who does, the kinds of things that we do, and you can really, make sure you're covering all those bases so they can have a good, healthy, safe, quick recovery.
As adults, especially as, parents and coaches, this is our adulthood, and, we really want to push our teams to do well, but at the end of the day, it is not that child. That child still has so much life left, and the choices that we make can have negative repercussions on their future and the things that they're able to do. And so I'm glad that this information is coming to light, that there's more research going on about concussions, that we're starting to line up the correlations to the causations of concussions. So I think there's a lot more that's going to be coming out in the next 10 or so years to really help us in this area of treatment.
Yeah.
We have come to the end of our series on concussions in children and adolescents. Thank you, Dr. Sally Dietz. The insight I have gained into concussions, especially being a mom of 3 who enjoys all of these different sports, has really been huge. So thank you for taking time to educate us today.
You're welcome.
To our listeners, I hope you've also gained insight into this topic, and we encourage you to explore many of the courses that we have available on elitelearning.com to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.